Day Trip, your hassle-free trip. Day Trip.
Okay. Hello, everyone. Good evening. Hopefully, you can hear me, everyone. Welcome to our Facebook Live on Next Generation NCLEX for tonight. We have prepared some questions for you regarding your next generation NCLEX. So, for tonight, we have different types of questions that I will be going over with you, everybody. So, thank you for being here with us. Before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I'm a nurse educator. I have been teaching nurses for so many years, almost 20 something years. And also, I'm a nursing faculty in the nursing program right now. So I have been teaching students. I'm an NCLEX specialist, teaching students, pastor, NCLEX RN, and NCLEX PN as well. And also, I am on process of revising my book and finishing the second edition of my book, which is the Simple, Fast, and Easy NCLEX Review, which you can find in Amazon, of course. So thank you very much, everyone, for being here. I would like to give a shout out to some people who are here tonight. So we have, I think the very first one who really came in tonight was we have Mami Lors. Thank you for being here. Quindi Dulay is our student for the previous program. And then also we have Ado Collins, Galina Nikitenko. As usual, we have Hima Joseph and Cyrene Santillan, Fergie Porras, Tiffany Fanor as well. So later on, we'll find out also how many people are going to be attending. So we have just Rukmina Fapa who just came over. We have Chinyeri Ogo Chukwu. Anyway, guys, without further ado, let's have the introduction for today. So, what I'm going to do is to introduce you some of my programs, and then after that, we can go ahead with the next generation and NCLEX. Okay, so if you're ready, everyone, let's have the following first. So, again, just a quick announcement. Our 10-day live comprehensive NCLEX review webinar is going to be on July 15 to September 16, 2023. That would be every Saturday from 8 to 4:30 p.m. Pacific Standard Time for US and foreign graduates. So, it's a blended learning course that combines live lectures and online assignments to master your nursing core content. So, this is a class that we have every Saturday. So, in the works also is we might be converting this class into an ongoing Saturday session. I'm not sure with you guys. Are you okay with having this class ongoing every Saturday? Because right now it's going to be July 15th to September 16th, but we may convert this into an ongoing class, which means to say that you can join anytime every Saturday. So that would be so no waiting time anymore for you to wait. For example, for the first day of class, you can just join anytime because it's an ongoing program. Okay, so we will find out, everybody. But let share me your thoughts in the comment section if that's gonna be okay with you, everybody. Okay, all right. So the next one that we have is going to be our, of course, our workbook. So pass your NCLEX in 30 days. Get our NCLEX Success Workbook. So the price for this right now is $99.50. And if you order, you can get the 3-month self-study online NCLEX review with all of my videos. And we also ship internationally, everyone. So we still have workbooks left right now. So you better order before we run out and we have to print again. So we only have a few copies left. So grab your copies, everyone, and you get the free 3 months self-study online NCLEX review. And of course, please share and subscribe to our YouTube channel so that we can be in the algorithm. Is going to be suggested more often if people are subscribing or sharing this Facebook Live, everybody. Okay. And of course, before anything else, we need to cover a little bit about the next generation NCLEX again. So the NCLEX test design, or the next generation NCLEX test design, is having 85 to 150 maximum questions, 15 non-scored questions, a maximum of 5 hours, and you're going to have three next generation case studies with 6 questions each, and that will be a total of 18 given before the first 85 questions. The exam is still mostly composed of classic question format. So if you have 150 questions in the NCLEX, you only have around 18 case studies for your next generation. And of course, some few case studies in addition, aside from the 18. And the good thing about the next generation NCLEX right now is that you have your partial scoring, partial credit points for some types of questions. So never forget, the 6 questions for the case study will be testing you based on these cognitive levels or clinical functions of the NCSBN clinical judgment measurement model. So the first question for those 6 studies, when you have 6 questions, will be about recognizing cues, wherein you have to identify abnormal findings or you have to identify important information. Then you have your analyze cues, which is basically linking the cues into the clinical condition of your patient. Then you have prioritize hypothesis, which is identifying what is the high risk condition or complication that may be happening. Then generate solutions, which is basically starting to think what kind of interventions are you going to provide or what order will be given by the physician or the provider. And then take actions means that you're implementing the nursing interventions. And lastly, evaluating outcomes will be assessing or evaluating if your expected outcome matches your actual outcomes, or is the patient getting better or worsening or improving. Okay, so take note of this clinical functions, the 6. Then of course you have your new standalone item types. So in this session we'll be covering some of the examples of these questions in the next generation NCLEX. And then the scoring models as well. For the scoring models, just remember that you have the 0-1 scoring. The 0-1 scoring is basically when the examinee gets points for correct answers, but there is no deduction for incorrect answers. Now, the plus minus scoring is the one that you have to be careful a little bit as well, because the plus minus scoring is your correct minus wrong, which means to say that whenever you put more answers, there's a possibility that your wrong answers will be deducted from your total scores. And lastly, you have your rational scoring. I'm going to give an example of this later on. It's basically when you're given a paired information or a cause and effect relationship, and you need to identify the cause and the effect. So meaning that you need to justify the rationale for the first answer. So I'm going to give you an example of that later on, your rational scoring. But so far, the most common scorings that you have, or scoring models or rules that you have for the next generation NCLEX, will be the 0-1 scoring or the plus minus scoring. And I will also tell you how you will be scored in these items as well. Okay, everybody, can you type yes if you're ready, everyone? Okay, are you ready for our first question? Okay, our first question. So, our case situation for tonight is going to be on endocrine disorders. Endocrine disorders we will focus on one particular endocrine disorder, which is really very common in your NCLEX licensure, okay, or in your next generation NCLEX. All right. So let's have the first question. I'm gonna slow down because we have 4 questions for tonight. So I'm gonna slow down so that you have time to process and read the questions. Okay. All right. So let's have the first question, everybody. Okay, so this is the question that you have, next gen NCLEX question. So the nurse in the emergency department is caring for a 28-year-old client who had a traumatic head injury. Nurses notes, at 10 o'clock, the client was admitted in the emergency department after a motor vehicle accident. The client is stuporous and unable to respond to verbal stimulation. A GCS score is 12. You also have PERLA, which is pupils equal round reactive to light and accommodation. The provider withheld any sedating medications at this time, no vomiting episode, and the client is placed on seizure precautions. The vital signs are temperature 98.6, blood pressure is 100/70, pulse is 104, respiration is 18, and your pulse oximetry reading is 95% on 4 liters per minute of oxygen via nasal cannula. So the question is, which of the following assessment findings require follow-up? Select all that apply. Number 1, you have your blood pressure. Number 2, pulse oximetry reading. 3, the pulse rate. Number 4, the respiratory rate. And number 5, the level of consciousness. And of course, you have number 6, the temperature. So, what do you think will be your answer? So, this is a case, traumatic head injury, and you have all of the vital signs and the information. So, read the information. Can you also let us know where's your location, everyone? Are you in the United States of America, or are you in outside the United States of America? Okay, so you can put your answer in the chat box or in the comment section. Okay. So client was admitted in the emergency department after a motor vehicle accident. Stuporous and unable to respond to verbal stimulation. The GSCS, the Glasgow Coma score is 12. Perla. Provider withheld any sedating medications at this time. No vomiting episode. Client is placed on seizure precautions. So evaluate everything and you can put your answers on the comment section now. Okay. All right. Let's see your answers, everyone. Is it one, two, three, four, five? Okay, or six. So this is select all that apply, meaning that you can click as many answers as you can, but be careful, guys. This is a plus minus wrong. This is a plus minus wrong scoring. This is a plus minus wrong scoring. So be very careful because whatever your answer will be deducted, your incorrect answer. So be very careful. Okay. So this is a plus, okay, minus wrong scoring model. So be careful. Okay. So this is select all that apply. All right. So some of you are putting your answers now. Okay. So some of you are putting 1, 2, 3, 5, 1, 3, 5. Okay. What will be the answer? Okay. What will be the answer? Okay. So the answer for this, everyone, is going to be. Okay, let's have the answer very quickly. So the answer to this, everybody, is going to be, let's see, this is a correct minus wrong item. Okay, correct minus wrong item. And you have to look at the information on the side. So you have your Glasgow comma scale, which is only 12. Then you have your Perla. So the answer for this, guys, is going to be, let's see. All right, so you're correct. So that would be um, the blood pressure. Okay, why the blood pressure? Because the blood pressure is only 100 over 70, so that's quite low. And your pulse rate is 104, which is tachycardia. And then your level of consciousness, so you have your stuporous, and at the same time, your Glasgow Coma Scale, which is 12, which can indicate the presence of mild head injury. You have to remember, everyone, that your normal Glasgow Coma score is 15, and 12 is a little bit of a abnormal, of course, in case you have slight head injury there. Although we know that a score below 7 or 8 is going to be a comatose condition. Now, you also have your blood pressure. We all know the normal blood pressure is 120 over 80, and your patient is only having 100 over 70. And then there's nothing wrong with the pulse ox because the pulse ox is 95%. Your normal pulse oximeter reading is going to be 95 to 100%. So there's no problem in the oxygenation of this patient, or there's no problem with your pulse oximeter reading. Then if you look at your respiration is 18. So that's within the range, of normal adult breathing, which is 12 to 20. And then your temperature is also normal, which is 37. So we don't have any problem with that. So congratulations for those who got the right answer. We have Tiffany, we have Aramidi, you also got Mami Lors. Congratulations as well. So congrats, guys. Okay. So now what we're going to do, guys, is we're going to have the next question. Okay. So let's go to the next question, everyone. Okay. So this is your next question. This question is going to be what type of question is this? I think this is your extended multiple response matrix. When you say extended multiple response matrix, it means that you have rows and columns, and you have to put your answer. Okay, there should be at least one answer in each column, okay, or row. And I think in this question you can put as many as you want, so be very careful because the scoring for this is going to be plus minus scoring, which is the correct minus wrong. So be very careful. Now you will also notice that in this situation you have additional documentation now. So from 10 there is now 11 a.m., which is additional documentation. So let's read the question, everyone. So again, the nurse in the emergency department is caring for a 28-year-old client who had a traumatic head injury. So that's the situation, the same thing. But if you look at 11 a.m., there is a new entry. So the new entry has urine output of 800 ml of colorless urine with decreased skin turgor and dry mucous membranes. Provider notified of findings. So what is going on here with your patient? The urine output is 800 ml, colorless urine. So now on the right side, you have this question. The nurse has reviewed the nurse's notes from 10 and 11. For each client finding below, click to specify if the finding is consistent with diabetes insipidus, syndrome of inappropriate antidiuretic hormone secretion, or SIAD or SIADH, or diabetic ketoacidosis or DKA. Each finding may support more than one disease process. So you have three conditions here, and you have to identify the signs and symptoms of each condition. So let's try. Number one, you have your polyuria under the client finding. So try to find out, is polyuria found in diabetes insipidus, SIAD, or DKA? Then you have your polydipsia, which is excessive thirst. Then next you have weakness, stupor, and then lastly you have your dehydration. Now each column must have at least one response option. So what I would like you to do is, probably you can write the word polyuria and then you can mark if it is 1, 2, 3. Your diabetes insipidus, DKA, or SIAD, and then you have your polydipsia, then you write your answers as well. So I'll give you a little bit of time to process this case study, because usually when you have next generation questions like this, you will spend a little bit of time. And do you know that among all of the formats of the next generation NCLEX, the bow tie question is the one wherein you will spend a long time, because with a bow tie, you have to read the scenario and then you have to answer these five correct options. So we'll discuss more of the bow tie question next time. Okay. So just read the situation right now and look at the matrix or the table, and then find out if those symptoms are consistent with one of the conditions. This kind of question is really trying to test you if you know your different signs and symptoms for different disorders. Because the worst thing that we can ever do as nurses is when we are not really able to identify what's really going on with our patients. And that's why the foundation of your next generation NCLEX is really mastering the signs and symptoms of your patient, or the signs and symptoms of condition. That's really very important, because you need to figure out what's the condition of your patient in every situation or clinical scenario. Yes, Mayara Sharma, thank you very much for being here tonight. And then we also have Iano Nimis, okay, Tiffany Fanor. So, and then I'll give you a few moments to process and put your answers on the chat box. Again, just a reminder to everybody, our 10-day live NCLEX review webinar will be starting on July 15, okay? And that will be until September 16, everybody. So check our website. Camille and Pangilinan, thank you very much for being here tonight as well. We have exciting questions for you for Next Generation NCLEX. You can also find this Next Generation NCLEX Facebook Live in our YouTube video channel. All right, you can put your answers now. I'm going to give you for a few more minutes, and I'm going to have to put the answer, okay? Adu Collins, welcome also for joining us tonight. All right. So where's your location? Adu Collins, are you from the United States? Okay. Yeah, anonymous. Okay, let's see. So what do you have, guys? What's the answer? I'm gonna give you the answer, everyone, okay? Because this is a complex question, but just try to find out if your answers are correct. So, Virginia, okay. So, for this question, the answer will be, I'll give you the answer, everybody. Okay, the answer to this question will be the following. All right, so those are the answers. Now, you have to remember that polyuria is present in diabetes insipidus and your diabetic ketoacidosis. In your diabetes insipidus, you have the lack of ADH, especially in this situation, you have a traumatic head injury. So this is a type of central diabetes insipidus, which means to say that there's a lack of ADH because of trauma to the pituitary gland. So that's why there's going to be polyuria, which is increased urination. And we all know that for diabetic ketoacidosis, you have also polyuria, because of the hyperglycemia that leads to polyuria. So review your DKA very well. Now, your polydipsia or excessive thirst will be found in diabetes insipidus also, because in diabetes insipidus, your patient is having excessive urination. So this patient is dehydrated and needs to drink. The same thing with DKA, you can find that as well. Now, in SIADH, there's no polyuria or polydipsia. Remember that. No, in SIADH, there's no polydipsia or polyuria. The reason for that is because your SIADH is more of a condition wherein you have more ADH. So what happens in SIADH is basically water retention. In diabetes insipidus, remember P, that means your patient is having increased urination. Okay? Now, weakness could be found in all of them. Okay? And then your stupor is going to be all of them as well. Especially when you have SIADH, you also have stupor because you have water retention and possible cerebral edema. And lastly, you have your dehydration, everyone. Dehydration will be present for diabetic ketoacidosis and diabetes insipidus because you have increased urination. So look at all of those. So if you have to look at the situation, when your patient here has voided 800 ml, then what complication are you thinking? Always remember that when you have a head injury, that is one of the most common causes of trauma to the pituitary gland, and that will cause the patient to have a lack of ADH, and that can lead to diabetes insipidus, right? So probably our patient here is experiencing diabetes insipidus because of the 800 ml of urine. Okay? And of course, because of the incident of head injury. So let's continue to the next question, everyone. Are you ready to the next question? Let's see. All right. Okay. So this question is known as the drop down close question. Drop down close question, wherein you have to fill in the blanks, the spaces in the sentence. So the same situation, the same documentation, but on the right side, what you can find is the nurse has reviewed the nurse's notes from 1000 and 1100. Complete the following sentences by choosing from the list of options. Number one, the client is at highest risk for developing. Is it hyperglycemia, dehydration, pulmonary edema, or hypoxia? The second one, it would be most important for the nurse to monitor the client for heart failure, electrolyte imbalance, paralysis, or muscle cramps. Okay, so what's your answer, guys? I'll give you time a little bit. What's the danger in the situation? Okay, what's the danger? Complete the following sentence by choosing from the list of options. So what's the danger? At highest risk for developing what first? What's the highest risk of your patient? Okay, put your answers now. It would be most important for the nurse to monitor the client for. All right, so some of you answered dehydration. Okay, let's see. And then next, it would be most important for the nurse to monitor the client for what? What do you think? Most important, meaning you're talking of prioritization here. So this question is testing you under the clinical function of the clinical judgment measurement model that would be prioritizing hypothesis, which means to say that, so now what? What's the highest priority here? All right, so let's get the answer. I think most of you have it. Let's see. Okay. The answers, everyone, is correct. Very good. So the answer is going to be dehydration and also electrolyte imbalance because you have a condition known as diabetes what? Insipidus. So remember everyone that diabetes insipidus is the hyposecretion or the lack of ADH, which could be caused by a stroke or CVA, surgery or trauma or a head injury. And what happens is the kidneys are unable to reabsorb water because of the lack of ADH. Now remember, there's two types of diabetes insipidus. There's what you call a central diabetes insipidus, which basically, when you say central diabetes insipidus, meaning that you lack ADH because of problems with your pituitary gland. There's also what you call a nephrogenic diabetes insipidus, meaning that your kidneys are not responding to ADH. Okay. So signs of diabetes insipidus would be polydipsia, dehydration, colorless urine, a low specific gravity, fatigue, muscle pain and weakness, and then also have your headache. But of course, the number one sign of diabetes insipidus would be a very large amount of urine or urination. Okay, very good. So let's go to the next question, everyone. Okay, are you ready for our next question? Okay, I think this is the last one. Okay, so let's see, guys. All right, so we have a matrix question. This is a multiple choice matrix question. Multiple choice matrix. Okay, you only can put one answer for each column. The same question, but it says for each potential nursing intervention, click to specify whether the nurse's notes intervention is indicated or not indicated for the care of the client. So, what are your interventions for diabetes insipidus? Um, Remember, everybody, in the NCLEX, NCLEX will not tell you that your client is having diabetes insipidus unless it's in the diagnostic test results. Okay, so most of the time in the NCLEX, you have to figure out what condition is present, unless there is a diagnostic test that was carried out and the patient was diagnosed. But if not, then you have to presume this patient is having diabetes insipidus. All right, Celestine, congratulations for getting correct answers for that question. You got your 2 points for that. Very good. So, for potential nursing intervention, the question is, are you going to monitor the intake and the output, obtain an order for intravenous fluids, monitor the specific gravity of the urine, request an order for administration of desmopressin, and also lastly, you have your restrict fluids. So put your answers in the next few seconds or minutes, guys. Okay. So you can type on the comment section the ones that are indicated. Indicated. And I hope this session is helping you, everyone. If this session is helping you, then can you please click yes or type yes in the comment section so that I will know and we can keep doing this. And of course, in my new book, I will have samples of these next generation questions. So my book is going to be revised. My book will have facts about next generation NCLEX and also sample questions and strategies on how to answer, just next generation strategies. It doesn't really have sample questions, but maybe some, but not really like thousands. Okay. So strategies. Okay. So let's see for the others. You're putting your answer. Okay. All right. So what do we have here? So what's the answers? Now, for our session every week, or hopefully it's gonna happen every week, or maybe once in a while, I don't know. But um, we only have simple next generation questions in these sessions because the actual next generation questions will also have tabs like laboratory results, diagnostic tests, vital signs. Maybe we can do that later on. So for now, we only have simple case situations for now. Okay, We don't want to make things complicated. I want you to get a little bit of an idea, of what next generation NCLEX is, because I know that most of you are going to get Q banks anyway. So in your Q banks, you have more freedom to answer questions, and they will be more complicated. But I'm sure everybody, do you agree with me? You can type in the comment section. Do you agree with me that at the end of the day, the most important thing about next generation NCLEX is just really knowing your content? Am I right? Your content, knowing your symptoms and how to analyze. Okay, so let's have the answer to this question, everyone. Okay, so for this question, your total is going to be 5 points. Okay, 5 points. 1, 2, 3, 4, 5. Five total. Okay, this is not correct minus wrong. You're just going to get points here. Okay, so 5 points, everybody. So you have, yes, Celestine, she said, content is the key. All right, so we have that in our review program anyway. So this is your answer, everybody. Okay, very good. So you have monitor intake and output. That's important because in diabetes insipidus, you have increased urination, IV fluids. Monitor the specific gravity because you have decreased specific gravity, and then request an order to administer desmopressin. Now, desmopressin or vasopressin is your medication for diabetes insipidus. Okay, desmopressin or vasopressin, that's the synthetic form of ADH that we give to your patient in order to reabsorb water. We do not restrict fluids. Fluid restriction will be for SIADH. For diabetes insipidus, if your client is alert, you have to offer fluids to your client. So, what are the other interventions for diabetes insipidus? Monitor your client's vital signs, especially neurologic status. Monitor electrolyte values and for signs of dehydration, of course. Maintain client intake of adequate fluids. IV hypotonic saline may be prescribed to replace losses. Monitor intake and output. Weigh your client. Reinforce the client to avoid foods that produce diuresis. So this is really very important. If your client is having diabetes insipidus, you tell the client avoid anything or drugs that will make you pee or increase your urination. So don't take diuretics or caffeine because they're going to increase the urination. Vasopressin tannate or desmopressin acetate may be prescribed. And then reinforce instructions to the client regarding the administration of medication as prescribed. Well, the keyword is reinforce instructions. In the first place, if you're the RN, then you are the one instructing the client. But if you're the LVN or LPN, you're just reinforcing information. Okay? So all these health teachings, when it says reinforce, that falls to the responsibility of the LPN, which is reinforcement only of information. The one who really teaches the client is going to be the RN. Okay, and then reinforce instructions to the client to wear a medic alert bracelet. Medic alert bracelet. Okay, everybody, I hope that you learned something tonight. Okay, so thank you very much, everyone. I hope that you learned something tonight about next generation NCLEX. So next time, I'm going to make an announcement for our next session, everyone. And I will see you, everybody. Thank you very much and good night. And I hope that you learned something tonight. Okay, bye-bye.